Hello, I'm John Foster, and I'm a medical doctor who does Social Security disability exams. And today, I'm not going to be talking about disability exams. I'm going to be talking about my experience having COVID-19 and my suggestions or recommendations for others who may fall prey to this illness. As usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Also, I'm not going to get into the controversies surrounding COVID. COVID is now treated as a political or even quasi-religious issue, which I think is a huge mistake. COVID is caused by a virus. A virus has no brain and can't move. It's closer to a rock than to a living thing. It doesn't care about your politics. COVID doesn't care if you supported Hillary, Trump, or Biden. COVID doesn't think that Black lives matter. One of the patients I saw recently was a Black person who had a severe case of COVID over a month in the ICU on a ventilator, and 3 of their immediate relatives died of COVID. COVID also doesn't think that white lives or Asian lives matter either. I've said since the beginning of the pandemic that treating it as a political or religious issue was a huge mistake. And I've seen this happen once before in my medical career. I'm old enough that I've seen the HIV/AIDS epidemic from the very beginning. And thousands of Americans died because it was treated as a political or quasi-religious issue rather than an issue of infectious disease. In fact, the very first patient I diagnosed with AIDS in 1981 contracted it as the result of politics. Young physicians today need to understand that at that time, there was no treatment for AIDS. The first anti-HIV antibiotic, zidovudine, had not been invented, and the average lifespan after an AIDS diagnosis was 6 months. It was a death sentence, similar to pancreatic cancer. With that out of the way, I will state that I've been vaccinated against COVID. I've had the initial 2 vaccines and 3 boosters. Obviously, they didn't prevent me from catching COVID. Whether they helped or not, I really don't know. They may have prevented me from becoming more sick or even dying, but that's all speculation. So here's what happened. I know when I was exposed. I was not wearing a mask. I don't really know if masks help or not. My best guess is they probably help a little bit, but that's only a guess. 48 hours after exposure, I felt like I was coming down with a mild cold. That was in the evening, and I went to bed. When I woke up in the morning, I felt like I had a medium cold. And I did a home COVID test, which was negative. That brings me to my first recommendation. I would recommend that you have a supply of COVID tests at home, at least 2. Why 2? Well, throughout that day, I felt sicker and sicker until in the evening I felt quite sick indeed. Every time I tried to stand up, I felt like I was going to pass out. I did a second home COVID test and it was positive. So that's the first take-home message. Your initial COVID test at home may be negative even though you've caught the virus. So at 12 hours, I had a low fever, about 100.0. I ached all over. I had a sore throat, and I felt very dizzy whenever I stood up. I immediately got a Paxlovid prescription and began Paxlovid about 12 to 14 hours after my initial symptoms. I also drank a lot of Gatorade, which really helped with the dizziness, and that brings me to my second recommendation. Have some sort of drink in case you feel dizzy or get dehydrated. You could use Gatorade, Powerade, fruit juice, rehydration salts. Just have something besides water to drink. I then went to bed. In the morning, I was surprised to notice that I felt considerably better. Not all better, but much better than I had in the previous evening. I continued to take Paxlovid for the 5-day course, and by the end of 5 days, I felt well, so well that I'd even resumed exercising. I was really impressed by the effects of Paxlovid. However, 48 hours after stopping the Paxlovid, I felt ill again. Again, I had a low fever, maximum 100.1 degrees. I had chills and sweats, aching all over, a sore throat, and a very runny nose with profuse amounts of very sticky mucus, almost like glue. I also had pain in my upper premolar teeth, and only my upper premolar teeth, which I thought was very interesting because each time after I've had a COVID vaccine, for the next 24 hours, I've had body aches, low fever, and pain in my upper premolar teeth. It must be some sort of reaction to the spike proteins of the COVID virus. So I decided to take a second Paxlovid prescription. Relapse after the first Paxlovid prescription is well documented, and the recommendation is to repeat the prescription. So I got another prescription. Again, 10 to 12 hours later, I felt much better. Not all better, but much better. After finishing the second Paxlovid prescription, the disease just grumbled on at a sort of low-grade level, and in total, I was ill for 24 days. I also had a dry cough and frequent sneezing. Now, Paxlovid is a combination of 2 different antiviral antibiotics. I would strongly recommend that you figure out how you would get Paxlovid in case you become ill. It can be prescribed by a doctor or by a pharmacist. A couple of things you need to know. 1, if you have severe liver disease, you should not take Paxlovid. 2, if you have severe kidney disease, you shouldn't take Paxlovid. If you have moderate kidney disease, there's a lower dose of Paxlovid you can take. And if you have mild or no kidney disease and no liver disease, you take the full dose. Also, there's a long list of medications that interfere with Paxlovid. Most of them can be stopped for 5 days, but again, it's best to find these things out in advance or discuss them with your doctor in advance. So when the time comes that you need Paxlovid, you're not wasting time trying to figure out these issues. It's very important to take Paxlovid as soon as possible. The sooner you take it, the more effective it is, and it's probably not effective at all if you take it more than 7 days after coming down with COVID. Also, Paxlovid is for people with mild to medium COVID who are not hospitalized. For people with severe COVID or who are hospitalized, there are other medications that are indicated. Some more recommendations. Number one, I would recommend that you have a reliable and accurate thermometer to check your temperature. I use a BRAUN ear thermometer, which I've had for quite some time. It's a bit expensive, they're about $60, but I think they're one of the best consumer thermometers on the market, and the extra money is worth it. Second, I recommend that you have a pulse oximeter. This is mine. A pulse oximeter measures the amount of oxygen in your blood and also your pulse rate. I would recommend that you check and see what the normal reading is for you when you're not sick, and then you can monitor yourself if you do become sick. Normal blood oxygen is usually about 95 to 99%. It's never 100% for complex technical reasons. Below 95 usually means that you have a problem with your lungs. Below 90 means that you have a serious problem with your lungs. And below 85 means that you have a very serious problem with your lungs and you belong in the hospital. Again, I would recommend that you know what is your normal pulse rate when you're not sick. If your pulse rate is more than twice normal, you're probably seriously ill. If you don't know your normal pulse rate, if your pulse is over 120 beats per minute, you're probably seriously ill and probably need medical attention. My biggest worry when I had COVID was that I would develop COVID pneumonia. I was quite impressed by the copious amounts of mucus that I made in my nose and throat, and how sticky and glue-like that mucus was, and how hard to get rid of it was. I thought if I got this problem in my lungs, I could be in very serious trouble. The warning signs that you're developing pneumonia are shortness of breath, coughing up large amounts of mucus from your chest, coughing up blood, or having pain in the chest when you inhale deeply. Any of those issues mean you probably need medical attention. I was lucky I never got COVID pneumonia. Some more recommendations. I would recommend you have a medicine for fever. I used Tylenol. I would also recommend a medicine that's available over the counter called Mucinex. I'm going to leave written list of my recommendations in the description to this video below. Mucinex is a medicine that's designed to make mucus thinner and more watery, and therefore easier to cough up and get rid of. I would recommend that you have something for sore throat. I used lozenges. Fisherman's Friend is a good brand of sore throat lozenges because sore throat isn't deadly, but it did bother me quite a bit. Another thing that I took was vitamin D. In fact, I've been supplementing with vitamin D throughout the pandemic, taking 2,000 units a day. It's a little bit questionable. We know that low vitamin D levels are associated with more severe COVID, but we don't really know if that's a cause or an association. People who are in poor physical health tend to have lower levels of vitamin D than people who are in good health, and we know that people who are in poor physical health do worse if they become infected with COVID. Nevertheless, I feel that supplementation with vitamin D is harmless and may help. It is possible to poison yourself if you take very high amounts of vitamin D, and I wouldn't recommend a dose higher than 5,000 units a day. Other supplements I took are vitamin C, N-Acetyl Cysteine and Zinc Gluconate. Whether they helped or not, I have no idea. I've just heard or read that they may help, and they're basically harmless. Again, I've listed them and the dosages I took in the description to this video. They're all available over the counter. I'm completely recovered for about 10 days now, and it appears that I have no long COVID symptoms. I'm back to exercising, and my fitness is about 75 to 80% what it was before I got COVID. What would have prompted me to go to the hospital? Again, it would have been signs of serious COVID pneumonia, shortness of breath, coughing up large amounts of sputum, coughing up blood, or a low blood oxygen saturation level, especially if it was below 90. One more thing, infectivity. I would cough and sneeze all day and half the night, and I had so much phlegm, I'm sure the air in my home was saturated with droplets containing the COVID virus, and it would have been very risky for anyone to be in the same house. Luckily, I lived by myself, and that wasn't an issue. But if there are other people in the home, I recommend that the person with COVID, if they're coughing and sneezing, remain in one room with the windows open if at all possible. Fresh air and sunshine are, in my opinion, the best protection against infecting others. With the amount of coughing and sneezing I was doing, I doubt that a mask would have protected another person in the same room with me. Well, that's all I have. I hope that nobody watching this video contracts COVID, but if you do, I hope this advice has been helpful. And always remember, if it happens, it's possible.